clients are workplaces, individual citizens, public authorities, occupational health services and other organizations developing and promoting well-being at work. And these are then some of the sectorial approaches which we are paying special attention. The municipal sector, particularly the healthcare, which is in great troubles because there are so many people who are going to retire during the next 5 to 10 years, and we do not at the moment have the people. They should already be in the pipeline, and they are not there. So we are going to have great troubles with our healthcare system, and we need to start accepting or promote, have some sort of work-related immigration system that to get nurses from Philippines or something like that. Otherwise, the aging population doesn't have the human care. The construction and property maintenance is a difficult sector, and it is also important in the future. The safety critical industries, which is something of a new type of there are some new type of critical points which especially in IT side. The retail industries, this is an example of a very low paid, usually female dominated occupations, and that's something which need to be developed in terms of perhaps also getting more men into these occupations, so that would hopefully increase the very low salary rates-based systems in those occupations. Professional transport and logistics, mining industry and manufacturing of metals, forest industry, agricultural enterprises and other entrepreneurs and small-scale enterprises. So these are these sectors which in our institute have been divided the responsibilities between our existing parts of our institute. So we are based in Helsinki, but we have 6 regional offices, and the regional office, for instance, in the north is going to be responsible for this mining industry and manufacturing of metals, because our mining industry is in that part of the country. So this is the way we are trying to manage the whole, not doing repetitive and overlapping works, but working in a systematic way. So the importance also is cooperation at the national level. The government is giving us 55% of our funding, and they require also special things from us. The universities and other research institutes we are doing in collaboration, and also collaborate with our clients at workplaces. The international activities we are doing in various levels. The global level through the WHO and ILO. We have special activities in Africa, in East African Community, which is funded by our Ministry of Foreign Affairs. Then the European level work is done, of course, with the European Union, but also then through the offices of WHO Euro and ILO office in Moscow, and then the sub-regional are these local collaboration with the Baltic countries and with the Nordic countries, which have long traditions. This is actually based on not the Finnish material, but this is a Whitehall 2 material. This is the civil servant study in UK, where they have been following these civil servants since 1980s. And this particular study was done between 1990, 1991 and 2001, 2002. That was, they studied the effect of working hours on cardiac disease outcomes. So coronary heart disease, non-fatal myocardial infarctions, or definitive angina pectoris, these were the end effects. And then they looked for people who regularly work 7 to 8 hours, 9 hours, 10 hours, or more than 10 hours. So in 10 years' time, only those people who were healthy at outset were taking part in this analysis. In 10 years' time, you develop a certain number of cardiovascular diseases, and they were recorded here. And it's so turned out that those who are working more than 10 hours per day, they have 56% higher risk of getting a coronary insult or cardiac insult. And these are now standardized for 21 known factors of cardiac disease. So working overtime might be hazardous to your health. From same data, there was an analysis that those who work over 10 hours per day, what is their quality of work, the productivity? And it seems to be going down. And also their cognitive capacity is lower. The type A personality, some of you might recognize that you are also a type A personality. It's a personality trait. Very ambitious, want to achieve a lot of things, very impatient. And these people also have an increased risk of cardiac insult. So thank you very much for your...
Oh, thank you for...